All right, so thanks for joining the office hours with Reimbursify. This is a topic for today, Benefit Verifications 101. So let's dive right in. So what I have on the screen here currently is sort of a typical out-of-network benefit summary, which shows you obviously a PPO plan, which is the most common plan that has out-of-network benefits. This shows an individual who has a $2,500 $2,100 individual out-of-network deductible and a $5,000 family deductible. And you see that they've already met the threshold for their individual deductible. And so what you see here is a 0 on the individual portion. And what this now means is that their benefits will kick in. One thing to keep in mind is it's only one of the two deductibles. If they have a family deductible in addition to an individual, only one of the two deductibles have to be fulfilled for the benefits to kick in. So in this case, this person will get 70% reimbursement of the allowed amounts through their plan. Now, if I was to, let me just jump ahead to illustrate that point. So you see, this is an example of a benefit report where $1,155 has been applied to both the individual and the family deductible. So this is an example where this person had claims filed or filed their own claims, totaling $1,155. And you see how it actually got deducted from both their individual and family deductibles. And so like I was saying earlier, just to emphasize the point, the same dollars by that same person apply to both deductibles, and only whichever deductible gets met first will then trigger the benefits, which in this case are also 70% of the allowed amount. What I'm going to do next is show you an example of an out-of-network benefit summary with an above-average deductible. So you see here that the deductible is $5,000 for the individual and $10,000 for the family for out-of-network services. And in this example, none of it has been fulfilled yet. So they have the entire deductible remaining for the year. We'll talk more about high deductibles here because I wanted to show you an example of a really high deductible. This is technically what we would call a high deductible insurance plan. It's a no-brainer. And in this case, the individual has a $13,000 out-of-network deductible and a over $25,000 out-of-network family deductible. And none of it has been met. And this plan does reimburse after the deductible has been met at a 70% rate. So what's important to keep in mind when you see, medium to high deductible amounts is, especially for high deductible plans, they will often require people to meet their in-network deductible as well. So it's not as simple as saying, well, this person might be, it might be more financially beneficial to go in-network. That is not necessarily true because you can look up their in-network deductible under the more detailed section of our benefits verifications. And you can see what that deductible is, how much of that is remaining. And one surefire way to know that they need to fulfill their in-network deductible before any benefits kick in is if they have coinsurance listed. So a lot of high deductible plans, such as this one, you'll see that this has in-network, they pay 10% of the fees, and out-of-network, they pay 30% of the fees. Now, in-network fees are usually lower, so they might be paying 10% of a lower amount compared to 30% of a slightly higher amount. But regardless, they have to fulfill either the in-network deductible first if they go in-network, or the out-of-network deductible if they go out-of-network. So it's not as simple as it might seem. How do deductibles get fulfilled? I already reviewed this, that if someone has an individual and family deductible, every dollar of services that they spend on, that's a qualified health expense, will get applied to both deductibles. And in this case, you see the same $1,155 got taken off both this person's individual and family deductible. So the next most common, it might actually be the most common question we get is, how do allowed amounts work? And I wish there was an easy formula or there was a digital way to bring you the allowed amounts. It's like everything in healthcare, pretty complicated. So one thing to back up and keep in mind is that even though most insurance plans are have the same companies involved, Aetna, Cigna, United, Blue Cross, Humana, a handful of others, every insurance policy is actually dictated by the employer. So you see here that most private health insurance in the United States are self-insured employers. So those employers are actually determining what benefit level they are going to offer for, down to things as specific as how much do I want to reimburse for out-of-network psychotherapy. And therefore, the best way to determine this, what an allowed amount will look like, is that larger employers, and usually ones in states that have more progressive policies towards mental health, for example, will have higher allowed amounts. And so what we see is that the amounts can range between, maybe 60 or 70% of what someone is charging in any given locale, up to 100% of what they're charging. For example, I've actually filed out-of-network claims for me and my family, and on a $185 appointment cost, the allowed amount was $167. So you can see that it wasn't exactly the same, but it was very close. And that was not a large employer plan. That was just one that I was buying as a small business owner. So there's no magic formula, but it's important to keep in mind, like if someone works for a big university or Apple or Google or NYU, they can have very healthy allowed amounts because it's those employer-sponsored self-insured plans. So another nugget of information in our benefit verifications is the ability to look up specific mental health services. Now, we in most cases, you don't need to, because what we base our reimbursement percentage on is the professional outpatient visit, which here, the section in the benefit verification is called professional physician visit dash office. The word physician's in here, but it doesn't necessarily just apply to physicians. It can be any independently licensed practitioner. So we bring you that benefit amount. So here in this case, it says 30% coinsurance, which would mean 70% reimbursement. You can see that. But if you wanted to look up more specific details related to mental health services specifically, if you scroll down in the detailed view down to the M's, you'll see mental health. And then there's another button here that says view more details. We're very soon going to be bringing this button up top to the summary, so you don't have to scroll to find it. But if you click that button, what you would see is specific types of mental health services. So for example, if you wanted to look up what inpatient mental health facility treatment would look like, you can look that up. Here it shows that inpatient in-network is not only a 50% reimbursement, but also an authorization is required. And that's usually true, most of the time, unless it's an emergency. If someone needs to be hospitalized, the insurance will require someone to, a healthcare professional to call and explain why someone needs to be hospitalized before they'll agree to pay for it. In this example, the out-of-network inpatient treatment for mental health also requires authorization and also has the same 50% reimbursement. If you look to the left of the slide, this is, again, for out-of-network, and the terminology for that in insurance parlance is, as listed here, out-of-plan network, which means out-of-network. But we have practitioners who, for example, do neuropsychological testing. And so you can see here it's listed. And what, one practitioner that I spoke with was very interested in is to know if neuropsychological testing requires pre-authorization. And you see that there's no pre-authorization listed next to neuropsychological testing, so it's not required on that type of service. But if you jump down 2 sections here, applied behavioral analysis, you can see that this does require pre-authorization / certification, and that's listed here. So if there's ever a need to look up specific types of mental health services and specific coverage levels, or whether pre-authorization is required, that's where you can do it. And finally, in terms of benefit verification, I wanted to cover a little bit about non-mental health related services. So we have a lot of our practitioners are outside of the mental health field. And for example, I pulled up 2 sections here, one on physical therapy and one on occupational therapy. And what you can find here is that on the left, you see in-network. This plan covers 60 sessions of physical therapy. And if you scroll down lower, out-of-network is a 30% coinsurance, which means a 70% reimbursement. If you look 1 section up, in-network physical therapy looks like it's a $30 copay, and they're limited to 60 sessions. So that's how I would read that section on the left. On the right, we see occupational therapy, and this can be a little interesting. So I recommend anyone who's in the physical occupational speech therapy field to look at any and all sections. So for example, this occupational therapy section here under individual actually says this applies to physical, occupational, and speech therapy. And this says not only are you limited to 60 sessions a year, but that pre-authorization is required even to access those 60 sessions. So very useful information for practitioners who are trying to give their patients and clients accurate out-of-pocket cost information. And we're at Reimbursify trying to bring that information to you to help you run your practice. Couple of points I'd like to make when we're discussing benefit verifications. If you haven't done this already, you need to liberate yourself from running your own benefit verifications. You can actually put our web app on your website. It looks like this in the bottom right corner. Powered by Reimbursify, someone can click verify your benefits, and they can submit their own information. So we'll collect this information for you and bring it to you: name, phone number, email, insurance, benefits. And then with 1 click, you can share it with them, or you can call them, or however you'd like to contact them. It's a great way to free up your time and to get more people engaged with your practice to see about coming in for an appointment. You can also send this out as a unique link to your practice. If you just want to send it to certain people or not have the button on your website, you can install a link instead on your website that will open a new tab in the visitor's browser. And when someone enters their info through your website or through that link, you'll get notified, and it'll actually show up in your benefits section of your portal as an unread message. And you see the icon next to the name that shows that they submitted it themselves. You see the little human icon there, and then the unread message icon of the envelope next to the date. And that can be a great way to get that transparency of out-of-pocket information flowing as easily as possible without you or your staff member having to enter each one and communicate each one on a phone call, for example. So that's the summary of benefit verifications through the Reimbursify system. I will open it up to any questions.
Vatsal, thank you. A question.